Today, we are really excited to be able to share the preliminary results associated with the Managed Care Readiness Assessment that many of you on the line today have completed. My name is Andy Kleek, and I am the co-director of the Managed Care Technical Assistance Center and the executive officer at the McSilver Institute at NYU. So as we get started, we're just going to kind of walk through exactly what the webinar is going to be about and just a little background information on MCTAC. We're going to share with you the preliminary results that we've gotten from more than 300 agencies around the state. After that, we're going to walk you through really quickly exactly what the benchmark report that each of you who's completed the webinar will have available to you. And then fourth, we're going to walk through an opportunity for those of you who have not submitted yet to submit. So we're going to walk through those things. A couple just preliminary logistics before we start. We've got 2 hours set aside for this webinar today. The actual content will probably be, I don't know, half an hour, a little bit more than that. And then we're glad to take any questions that folks have. So over the course of the webinar, please use the chat box. There's a Q&A box and a chat box, but please use the chat box. It's just easier on our end to manage that. We'll hold the questions until the very end and then kind of go through them systematically at the end. But as questions come up as we walk through the materials, please feel free to use that chat box and send them in as you think of them, because for those of you who are like me, you'll forget them by the end and won't remember what you wanted to ask. So feel free. I also want to emphasize that the readiness assessment results we're sharing today are preliminary. Even though most of you submitted this a while back, it actually getting all this data collated and put into a usable format, takes some time. And so there'll be some additional, more specific results that are able to come out from this in the future, but we wanted to push this forward to folks as much as possible, and really want to thank all of you who've completed a readiness assessment. So for those of you who are unfamiliar, who this is your first time, we've done this under the auspices of the Managed Care Technical Assistance Center, which holds a contract with the state of New York, OMH and OASAS, to provide technical assistance in this transition to managed care to all agencies, both substance use agencies and mental health agencies in New York State. At this point, we've reached, I think, almost 60% of mental health agencies and about 40+% of the OASAS agencies. So we're really excited about that. We've been able to do that in the last 6 months. We really are wanting to be able to work with everyone. So we want to be really clear that our real hope is to be able to work with everyone. So many of you on the phone have probably done a number of our different things, but we really are focusing on a couple different things. We're really focusing on providing foundational information, and we just finished up a whole series on contracting, around foundational information around contracting. If you didn't go to that, it's on our website. There's a full video of all of that. We're about to announce a whole new series on revenue cycle management, utilization management, and outcomes that'll be coming to you probably in the next 2 or 3 weeks. You'll see an email from us announcing that. We also have a number of tools. One thing I would highlight for folks is you have questions on our website, which we'll put up at the end. We have all the question and answers as well as the slides from our kickoff webinars, which really gives kind of the most, as far as I'm concerned, the most in-depth description of where the state is going on managed care. As well as, in addition to that, on our website, we actually just announced last week, we pushed out short acronym front and back page, which is actually going to be fall with a full glossary behind that, but we want to push out the acronyms as well. So go to our website and check that out as we move forward. So with that, we'll start talking about the readiness assessment. We rolled this out in October and collected it in October and November. All the data was collected online. We really asked agencies to work closely with a real core group of their management team, so not just the individual, somebody filling out a form, but a real group of the management team to pull all this information together. And it was really focused on looking at the level of readiness across a variety of different domains to really help agencies get a sense of where they are. And what we really want to do with this data is want you to be able to do with this data is a couple different things. One, it allows us in a global sense to be able to provide benchmark data back to you, as well as benchmark data back to the state. Not individual agency data back to the state, but benchmark data on the whole population to give them a sense of where people are across these domains. The second thing is to be able to allow you to start to be able to benchmark yourself against others so that you have a sense of where you stack up against the rest of the state. Okay. All right, so there's 11 different categories in this data, and I want to be really clear that this wasn't, developed where we all just kind of sat in an office one day and spent 2 hours and pulled together this assessment. This was really vetted by both OMH, OASAS, DOH, the city's Department of Health and Mental Hygiene, a couple counties upstate. We also sent it out to a number of different stakeholder groups, including the several managed care plans, the Plan Association, some advocacy groups. So we really did have this spread out over a very large group of stakeholders, and it really does represent kind of the best look from a kind of consensus view of what are the areas of readiness for managed care. So I think, and what we've also been to look, we actually were magically hoping that we could just steal somebody else's readiness assessment that had been done in some other state. And what we found when we looked at it was there really wasn't another tool out there that had been done like this somewhere else at this level of comprehensiveness. And so we really did develop this. We ran it by a number of different stakeholders. So I think it represents kind of the consensus in New York or the areas that agencies are going to have to work on. Okay, so we have one very simple poll question, and Amanda, if you could pull that up real quick, that would be great. Okay, so we have one poll question. If folks could just take a minute to answer. And the poll question is just, did your agency complete the readiness assessment, yes or no? If you don't know, you can just leave it blank. But just we'll give folks another 15 seconds or so to answer that. And then we'll kind of see what the results are. I'm hoping most people have submitted. Okay. Amanda, you can shut that down. Actually, I think you already did. Amanda and I have done this enough times that she kind of reads my mind. All right. We need to get some Jeopardy music in the background on these. For some reason, it takes longer to grade the questions than I would ever imagine. Oh, there we go. So it looks like most of the participants have completed the readiness assessment who are on the phone. So that's fantastic. And for those of you who haven't, we're going to talk at the end real briefly about how you can go about doing that now if you'd like to do this now. So it's totally fine if you haven't done it already, and we would really strongly encourage folks to take advantage of it. And if I can get where is the thing? There it is. Okay. So just some very high-level overview of what we found. So this data analysis is based on 313 completed readiness assessments. That represents about a third of the population in New York State, a third of the mental health agencies in New York State. So while as we develop more, this data will change a little more because we're going to really push people to complete the readiness assessment as we move forward, because I think it's kind of a foundational tool you want to do to be ready for managed care. So as we get more data, we'll update this over and over again, and it'll become more comprehensive. But I think this does provide a pretty good sample that we can kind of say some things from. So based on agencies reporting, about a third of agencies that completed this were OMH only, about a third of agencies that completed it were OASAS only, and about a third of agencies that completed it were both OMH and OASAS, kind of a combination of OMH and OASAS providers. We will at some point get that down into a little more detail and be able to kind of report based on agency size and those kinds of things. But at this point, we haven't done that analysis yet. But at this point, I think the OMH and OASAS providers could be kind of used as a proxy for size. Not entirely true, because I know there's some very large OASAS and very large OMH agencies that only do OMH or OASAS. But just in some ways, you can use that a little bit as a proxy for size. About half of the agencies did not score kind of in the top 25% in any factor. So one of the things that you're going to see over the course of this discussion is there really are some groups of agencies in here. That are, there are a group of agencies that are pretty sophisticated and while not entirely ready for managed care, because no one can be entirely ready. Anybody who came back with all fives are all ready for managed care on this really needs to go back and look at it again, because I don't think anybody's really ready for this transition. There's just too much unknowns and those kinds of things. But there's a group of folks that are at least feeling pretty comfortable with their readiness, and there's a group of folks who are really, really struggling, and I think we'll see that in the data as we go forward. I think the other thing I would highlight in this before we go forward is this data is all self-report. The data is all self-report, and so this is people's perception of their readiness, and that perception may be absolutely on target for some. It may not be on target for others. Folks may really feel like they're in a lot more trouble than they actually are, or vice versa, feel that they're a lot more ready than they actually are. So I just think it's important to keep that in mind as we look at this data, that this data is entirely self-report. Okay. There were no statistically, one of the big surprises that we saw, and it may change as we get more data in as we go forward, but one of the big surprises that we saw was that there was really no statistical differences between regions, between upstate and downstate. And there, depending on how we carve this going forward, that may change a little bit. But we didn't expect to see that. We thought that there'd be a big difference between upstate and downstate, between the city and those kinds of things, and we didn't see it. So it's just something to keep in mind as we go forward. There were statistically significant differences by reimbursement. So if you are already engaged in a managed care environment already, there was we found that, and I'll go into a lot more detail on this. We found that you were felt much more prepared for managed care than if you weren't, and that makes a lot of sense. And then there were statistically significant differences by agency type as well. Okay. So just some basic demographic information. The 313, so about 35% of the agencies that are part of OMH or OASAS have completed this, and about 65% haven't. So we're still pushing to get that number up. We'd love to get, personally, we'd love to get 100% of agencies to complete this, but we want to get at least over half or 2/3. But this was a really, for what we thought was a really tremendous response rate. So we had a nice broad regional breakdown, which is really good. So we were really worried we'd either only get people in the city or only get people in Western New York or whatever, and this actually breaks down fairly well and is a little tilted actually towards upstate, but it's a pretty good regional breakdown to give us a sense and something that we felt comfortable with in the background. Services offered by agencies, as I said, about a third were OMH, about a third OASAS, and about a third both. Others were other, and probably based on where they get their funding, that blends into some of these other things as well. We had one individual who wasn't quite sure where they got their funding from. Okay, so here's something, and we find this. So we had about a third of agencies get their funding get less than 10% of their funding from managed care, and then also the non-applicable group also fell in that category as well. And then a third of it, and then the rest of agencies get slightly more than that of their funding from managed care. So when we look at that, it's about half and half. About half the agency have little or no experience billing managed care, and about half the agencies have significant experience billing managed care. And I think that that's going to be borne out in the data as we go forward. Okay. So there are 11 domains, and for those of you who completed this, you're well aware of all the different domains. There are 11 different domains ranging from kind of the managed care priorities agencies, you know, understanding kind of what managed care wants, to contracting, to communication. And when we talk about communication in this sense, it's more around service authorizations and those kinds of things. IT system requirements, level of care, utilization management practices, member services, how do you deal with grievances, how do you deal with bills get kicked back, all those kinds of things. The interface between physical health, social support, and health homes, and that's an area that we'll see in the data, but that people felt pretty comfortable with, because you know, it's an area that we're already working on. Folks are already starting to work on integrated health. They already are building relationships across agencies in different social sectors and service sectors and those kinds of things. So it's an area that people felt relatively comfortable on. Quality management, quality studies, so basically the ability to demonstrate quality, and I also connect that very closely, and we actually did some other statistical analysis, which we're not going to talk about today, which actually connects some of that work. Really this whole idea of data-driven decision-making being a really key factor, and agencies either had that or they didn't. And so that connects really closely with number 11. So one is really evaluation, and one is really the ability to demonstrate your value to other providers. Finance and billing, really the nuts and bolts of billing managed care, and then access requirements. So those are the 11 domains that we really that we collected on. Okay, so let me explain the scoring system here. So there were two kinds of questions in this survey. There were a number of true and false questions, or yes or no questions in here, and those a lot of times revolved around did you have a person assigned to work on contracting? Did you have a person assigned to interface with managed care companies and those kinds of things? So there were a number of yes or no questions, and then the rest of the questions were a 1 to 5 Likert scale. So 1 was, I have no idea, and I need a lot of help. This is totally a new concept to me. I need as much help as I can get. And 5 was, I'm fully comfortable with the transition to managed care. So you'll notice that most of these mean scores, and just for anybody who's wonky on the phone, one of the other things we do is we converted those true and false or yes, no questions up into standard scores because each of, so that we can include them in this analysis. And the other piece is that the domains weren't equal in terms of number of questions, so we actually converted those all up into standard scores so we could compare across domains. There's all sorts of statistical wonkiness behind that, which goes beyond my ability to explain statistical wonkiness. But the bottom line is we were able to convert these so that each of these domains could be considered equally and can be compared with one another. So the average for these scores really hovers around 3. Some is a little higher than 3, some is a little lower than 3, but the average really hovers around 3. And 3 on this scale is, I have some idea of what this is, but I really do need I really would benefit from some technical assistance in this area. So that makes sense. And most people in most of these domains would really benefit from some TA. So I'm going to go through just real quickly. I mentioned this at the top. I'm not going to go through in a lot of depth, but these are the mean scores by region. So we looked at the city versus the rest of the state. There's probably other ways to cut this, and as we move forward, particularly if there's different regions that are interested in their own scores, we can cut this by region in multiple different ways. It gets a little complicated because OASAS and OMH have slightly different regions, particularly upstate. But we can cut this in more depth as we go forward. But basically what it shows is that the regional differences really across the board were actually, there just really weren't any of any real importance. So I'll just, I mean really in nowhere, there are some where it's a little bit different, but in general there really were no significant regional differences. And we'll send all these slides out so you can look at this in more depth as we go forward. Okay. So then we looked at that group that reported that they had more than 10% of their managed care revenue, coming from managed care, versus the group that reported that they had less than 10% of their revenue coming from managed care. So you'll notice here that there are significant differences, and both statistically and just by the eyeball test. Significant differences between those groups. We would absolutely expect that because if you have never built a managed care company in your life, then obviously you're going to have some real differences there than if you get a lot of your business from managed care. But what we saw is that there were substantial differences here. So, you know, we're looking at, in some cases, you know, half a point to a point higher, and in other cases, particularly around the things that really, really focus on managed care. So you think about authorization procedures, which is really highlighted in communication. If you look at in IT, and if you look at level of care criteria and those kinds of things, you're looking at almost a point difference in those areas. There wasn't a statistical difference in the area of interface with and really kind of integrated care, because that's an area that really isn't impacted so much by whether you work with managed care or not. That's an area that whether you know, you're already starting to do that, particularly if you're involved in health homes and all the kind of PPSs and all the things that are going on right now. It's an area that you're already involved in. But we did notice that these differences are sticking. And what it says to us is there really are these kind of two broad groups in this, in terms of RTA. There are these two broad groups. There's one group, and we'll dive into this data in more depth as we go forward, but there's two broad groups. There's one group that actually that needs some TA, and needs a lot of TA, and is going to need a lot of help going forward, but has a better and better understanding of kind of what to expect in managed care, and has a better understanding in terms of being able to kind of be prepared for managed care. And they'll probably need that kind of traditional group-based, you know, they need to know what the rules are, they need to know what they need to change in their system, they need to know all those kinds of things. But they may not need that kind of really, really intensive work that's required. And then there's this other group that is, you know, that is not billing managed care now, and they are going to need much, much more intensive services around technical assistance to really get ready for this transition. So that jumps out at us, and I think we just want to highlight that there really are, what we saw is, you know, sometimes you get this nice bell curve, but what we really saw is this kind of bimodal curve where you have a group that's feeling pretty decent, and you have a group on the other side that really is going to be in need of a lot of support. So this just kind of walks it through in finance. You know, in the areas of evaluation, I think I want to highlight for this, in areas of evaluation and quality, which I think is 9, so I'll go back real quick. Yeah, quality and evaluation, I think consistently were lower kind of across the board. While the differences between those two aren't as great on this, those two areas were consistently lower across the board. The other thing I'll highlight here is that the difference in the kind of global score is really more than half a point between those agencies that are currently working with managed care and those that aren't. And I noticed in here that we have a typo in here because we left the A out of OASAS. But this just compares the differences across agencies that report OMH versus OASAS versus both. There were statistically significant differences with OMH agencies, with OASAS agencies scoring a little better kind of across the board from OMH agencies. And those agencies that reported having both, which I think in this can be used as a proxy for size, those agencies reported better kind of across the board as well. The one area, again, here that wasn't as significant was this kind of integration of care, which, again, makes sense. And the areas that, you know, again, are lower kind of across the board are these areas around quality and around evaluation. And the global differences were also statistically significant. So that's just something we need to keep in mind as we develop programming, either target specifically at OMH agencies or target specifically at OASAS agencies. And also something to kind of keep in mind for you as you go forward. Okay, next slide. Sorry, the pointer isn't working. There we go. So the areas across the board where we really found the most areas of need, and these are the areas where the average score was really below, right around or below 3, were contracting. And so if you're below 3 on contract, if you really need some help on, so the areas were contracting, communication, IT, level of care, member services. So we've got, you know, about 8 of the kind of broad categories were really below 3. So these are the areas which I think, and relatively consistent with what we're going to be rolling out in terms of technical assistance, these are the areas where we're really going to put most of our focus. Okay, so we want to take a couple minutes for those of you who have completed the readiness assessment, and for those of you who haven't completed it yet and would like to. So every agency that completes the readiness assessment is going to get this report back on their agency's scores. It's going to be an individualized report. Every agency is going to get them. They're going to start going out tomorrow. Because of the software we have, they have to go out in batches. So I think we got 100 going out tomorrow, 100 going out. They're going to go out. Yeah, they're going to go out. They're going to go out over the weekend. I think by Monday or Tuesday, everybody should have one. If you completed a readiness assessment and you don't have one of these by early next week, reach out to us and let us know, and we'll make sure you get it. You know, I imagine there'll be a little. You know, we're sending out 300 of them, so I imagine there'll be a little bit of a hiccup in there too. So please do not hesitate to say, "Whoa, I didn't get mine." But every agency who's completed a readiness assessment so far, is going to get this report next week. The report has a couple different things in it. First, it has this average score. The average score is the average score across the state in that category. So it highlights for you exactly what the average score is in that category. So these are dummy numbers, but so in contract and understanding priorities, the average score was 3.3. And then next, in the next column, if you look at the next column, which conveniently is circled here, the next column, it also lists your score in comparison to that average score. So you can say, okay, the average score was a 3.3 and I got a 3.1. So we're right, we're a little lower than the average, but we're right in the ballpark. If the average score is a 3.3 and you're at a 1.2, then you're really kind of struggling. This may be an area where you are significantly behind the curve compared to the rest of the state, so you may want to really start to pursue some additional assistance. And then third, is the percentile score. So what's the percentile that you have compared to the rest of the state? And for those of you who aren't the kind of mathy folks, the percentile score, just if you lined up 100 people in a parking lot, what number of those people would you be? So 37%, you'd be the 37th person in that line, with the 100th person being the person who scored the absolute best, and the person number 0 or 1 would be the person who hadn't scored well at all. So that's kind of how the statistical scores work. Okay. So the other thing that's going to be in here is a link to our online work plan development tool. So what we've tried to do is, in each domain, really kind of across domains and across the things, to really identify some particular steps that you can take in order to improve yourself in this area. Some of it will refer back to things that you can do through MCTAC, where we've either offered already or are going to be offering technical assistance. Some of the items will refer back to other things that you might want to do that really focus on that. So if we go back to our thing, here at the very bottom of the, I'm going to use a fancy tool here. Hold on. Did I do that? There we go. So if you look right here, if you look right there at the very bottom of the thing, it's got recommendations. And so the recommendations will link you back to this page, which will list domain by domain, area by area, what are some kind of common recommendations of things you can do to start to get ready if you're particularly low in a particular area. So I really suggest that folks take a look at that. Obviously, we're going to be providing a lot of more intensive support around each of these areas, but we just wanted to be able to give some folks, as you get this report, or what are some of the things that we might want to start to consider as next steps. I strongly recommend, we're going to send the report back to the person who sent it in. And I think senior executives at the agency who have participated and whose contact information we have. So we'll send that report. It's all going to go out by email, so none of this is snail mail anymore. We'll send that report out to those folks. But I strongly encourage that kind of the first step is that you pull together that group that filled it out. And if you filled it out by yourself, pull together your group sit down with the readiness assessment. You can still print it out online. It's in PDF. Fill it out, look at your answers, look at this report, look at the recommendations, and really start to put together a work plan. And we're actually developing for another project we're working on a specific work plan for people to kind of translate that in. And so we'll actually, when that's formal, we'll get that out on our website as well. But really start to pull together a work plan that identifies how you did on this readiness assessment and some of your next steps going forward to what you think you're going to need to do to really be effective in making these transitions. Okay, so let's skip ahead. All right, so I've only got a couple more slides of this left. So if you have questions, now is the time to start typing those in. Now is the time to start typing those into the chat box. If you put them in the Q&A box, we'll get them there too. But please type them into the chat box now as we're kind of rounding the bend here. Okay, so this is I already said this, but I want to repeat it just so everybody understands. On Friday morning, we're going to start sending these out. So we have to do it in batches. So you may or may not get yours on Friday morning. It's kind of random as to what batch people went into. But on Friday morning, we're going to start sending these out in batches. And by the beginning of next week, everybody should have them. So if for any reason the system breaks in the morning, it's going to be more than the middle of next week before we start sending them out to people. We'll get a notice out to everybody saying, like, you know, we're delayed. But by the middle of next week, everybody should have their readiness assessment, their report. In that report is the link to the work plan. Click on the work plan, look at that, pull all your folks together. If you have any questions, please, if you have any questions, please send those questions to mictac.info@nyu.edu. Sometimes, if they're detailed questions, it can take up to a week or so for us to get back to you because we actually have a meeting that we set up that actually addresses questions and those kinds of things. So it takes a little while for us to get back to a detailed question. If it's just like I didn't get my report, hopefully we can get back in a couple days. But please, if you have any questions, send them into mictac.info@nyu.edu, and it will get to us. One question has come up already just in terms of logistics is, will the slides be shared? Absolutely. We'll get the slides. The slides will be up on our website. This webinar is being recorded, and it will be up on our website in the next couple days. So yes, the slides will be there. The webinar will be there. All those kinds of things will be there as well, as we always do when we do these webinars. Okay. There are some kind of important limitations to think about on this. I've highlighted some of these, but I just want to highlight them again because it's, you know, this is really important data. We feel really comfortable in the data, but, you know, as with any data, there are some limitations, and we just want to be upfront about that. First of all, as I mentioned at the very beginning, this is all based on self-report. So, you know, this is folks' perception of how they did. This is folks' perception of how they did. So we just want to be really clear on that. And the second is, it's based on scores relative to agencies that completed the assessment. So those agencies, you know, the benchmark is benchmark compared to other people who completed the assessment. Who knows, the other 60% might be totally ready for managed care, or the other 60% might be in no way ready for managed care. We just have no way of knowing that. And so, you know, these scores could vary if you know, we do that. The other thing is it's only based on a third of the population, and so I think we just need to highlight that it's only based on a third of the population, so there is still 2/3 who haven't filled it out. So that is important as well. If you haven't completed a readiness assessment, please visit mictac.org for an overview of the process, frequently asked questions, and hard copy printouts. For OMH and OASAS providers who only do adult service provision, you literally can click right here when you get the slides, and it'll take you there. But if you don't want to wait to get the slides in the next couple days, you can literally just go to mictac.org. It's all on there. I think it's very prominently displayed. If you also provide children's services, or you're a children's only provider, there's a children's addendum, so you complete the readiness assessment, but then there's a children's addendum that goes on top of that. So I would strongly recommend that you complete the children's addendum. If you did the readiness assessment a while ago and you're a children's provider and you didn't do the children's addendum, you can just go in and just complete the children's addendum. I believe the first question on there is literally like the children's, yeah, so the first question is, did you complete the regular readiness assessment agency? Okay, so we are at the Q&A portion, I think, of this. Yes, we are. So a couple of quick things. Here's our website, mctac.org. We have kind of like dueling websites at the moment. One is ctacny.com and one is mctac.org. We're in the process of actually developing a whole integrated website system, but as we're moving at 1,000,000 miles a minute, we want to get something in the interim up. So this is our website. Went up a couple weeks back in this format. The readiness assessment is in there. All of our tools, everything we've done is in there. Events are up there. So go there. If you have questions, mctac.info@nyu.edu. And also we are now on Twitter at ctacny. And so what we are doing on Twitter, we're not going to, if you're a Twitter follower, we're not going to flood your Twitter feed with, thousands of tweets. We usually just announce things that are upcoming that we're doing. And we also announce, relevant policy changes and those kinds of things that seem to be going on. So I'm going to start diving into the Q&A. So just give me a second to get organized, and we'll get into the Q&A. Okay, so the first question is really simple. I think we addressed this, but always good to address this again. Will the webinar and slides be available online afterwards? Yes. It usually takes us about 24 to 48 hours to get everything up on the website, but certainly by Monday morning, everything will be up on the website. The webinar is being recorded, so a full recording of the webinar will be there, as well as a PDF version of our slides, which you're welcome to download and use and those kinds of things as well. Will managed care plans have to follow OASAS and mental health coding guidelines? That's a question that's actually included in our frequently asked questions on the website, so I would strongly recommend that you go to the website and download the frequently asked questions, as well as the slides from the kickoff events, which goes through a lot of that detail, a lot of that in a lot more depth. If you look at that and you still don't get your question answered, feel free to reach back out to us at mctac.info@nyu.edu, and we will we'll get back to you. And for questions that are more policy related, we defer those to the state, but we get those and we send them to the state. The state answers them, and then we add them to our frequently asked questions list. The domains of the readiness assessment tool differ from the report. Is that correct? There is a little differences because this is kind of meant to be more of a general work plan than what we had at the beginning. Is there a benefit in refilling out the readiness assessment if we've made a lot of progress? While we haven't done that formally yet, we would be totally fine with that. If anybody wants to refill out the readiness assessment based on progress they've made up until now, we would absolutely accept that. When you do it again, go online, fill it out online, but when you submit it to us, please send it to us. Send a note to mctac.info@nyu.edu and say, look, I submitted in October. This is my agency name. I submitted again in February. This is my agency name. I submitted on this date, so we can link those two records back together, and then we'd be glad to score it again. But we want to make sure that it doesn't get lost and we don't end up putting it in the regular pool. And a note to go with it would be helpful. So, okay. So. Okay. Will there be any direct support in addressing individual reports? So if you go through your report and you have individual questions, please feel free to shoot us an email and we'll get back to you on those individual questions. We're hoping that the kind of recommendations can start with that initial stage, but we recognize there'll be we recognize that there will be more things going forward that people have questions about. Please feel free to those feedback. The other thing that we always take, and we take this very seriously, is also shoot us notes about areas of TA, especially as you go back to your report. It'd be really helpful to you. We're about to roll out a bunch of stuff, and any feedback we get on that is always considered to be very, very helpful. So so we do that. We aren't really set up at this point to do individualized technical assistance. We are going to be starting a number of learning communities around particular areas, particularly in the finance areas and utilization management outcomes to start in the very near future. And the other thing we're developing in the background is a list of consultants for folks, because there will be some folks who will need additional consultation and who are going to need additional consultation and will want to. So the next question that came in is, will these reports be sent to the OMH field offices? And I will direct this both at OMH and OASAS field offices. They will not. One of the commitments that we have gotten from OMH and OASAS and DOHMH as well in the city, and et cetera, is that we are not going to be sharing any individual agency's report or scoring or any individual agency data with OMH or OASAS or anybody else for that matter. We have this basic report you saw today, OMH and OASAS saw a little while ago, and we walked through this same level of detail with them, just kind of walking them through so they had a sense. But we do not share any agency's individualized data with anybody. You are welcome, though, to take your report. You are welcome to take your report and share it with whoever you would like to. So that is your data, and one of the reasons, in addition to giving you this data, that we wanted to give it back to folks is that we wanted to make sure that agencies had access to this data, and then you can use it, and you can use it in conversation with your local field offices, et cetera. We have been asked by the field offices, by OMH and OASAS, to share with a list of agencies that have completed the report so they know who's completed it, but that's about as far as we go in terms of sharing anything. It's just kind of who's participated. All right. All right, so we're good. Apparently I gave the right answer to the question, so we've gotten a little backed up in questions, so we're going to take 1 minute to kind of get through questions. Can we have a list of the managed care questions participating in the change? The managed care questions participating in the change. There is a list online of the managed care companies at DOH, and if you shoot us an email, we can get you this direct link. At DOH of agencies, managed care companies that participate in each region or each county. At this point, that's about the best list. OMH is in the process, I think, unless it changed in the last couple. OMH is in the process of OMH and OASAS and DOH are in the process of finalizing the ones for the city right now, unless that's changed in the last couple weeks. And so those final 10 in the city will be announced very, very shortly. And once that gets out, we'll send that out to everybody. Upstate, the RFQ has not been completed or finished yet, and so they're not available upstate. The likelihood is that the managed care companies that are, the Medicaid managed care companies that are providing services for you now in New York State will continue to be providing services going forward. Hold on. So we're going to take 1 second while I kind of get caught up on questions, and I'll come right back and jump right back in. One other question came in on how are CDT programs being billed to the MCOs. That question is addressed in the frequently asked questions and also the slides from the kickoff event, so I'd point you in that. Direction. Okay, so Meg's going to start reading off questions to me, and I'm going to go out. People are asking lots of questions, so okay.
Can the results of this tool be broken down by type of provider? For example, OASAS medication-assisted treatment versus OASAS inpatient.
So the question is, can we break it down by type of provider? We will do that going forward. The level of complexity in doing that gets to be a lot more labor intensive, and we didn't want to wait to get results out to people because we felt we'd waited too long already. So we will do that over time and break it down by the provider types, and that'll be something that we do over time, and as we do that, we'll report it back to folks as well.
Is the date still April 1st or managed care enrollment?
There is a soft enrollment period starting on April 1st. Formal enrollment, by I mean you will be billing managed care, starts on July 1st in New York City. The details of that in a formal way, I wouldn't take anything I say on a policy level as you know, kind of the final word. The actual language and details around that are on both OMH, DOH, and our website. And it has been in, I think, the last, a couple of the last, we send out weekly updates, has been in those updates as well. All right, next thing. Oh, here, I'll do that. If you have not taken the process, what is the process? How do you complete the readiness assessment? You can just go to the MCTEC site at any time and fill it out. You can go to the MCTEC site at any time and fill out the readiness assessment. If you have questions, shoot us a note. All right, next.
Has there been any more discussion about a timeline for OMH residential conversion to managed care?
Not to my knowledge, but keep in line with our frequently asked questions, and as there are updates, we'll put them out there. And you know, any big policy announcements we'll try to get out as well. But also really keep closely looking at the OMH website and check in with your field offices as well.
Can you also crunch the data to give us data on where an agency scores among similar sized organizations and by organizations providing the similar types of service? Yeah, so that's an excellent question, and along the line of the different program types, that's kind of the next level of data analysis that we're going to do on this. But it gets much more complicated to do that. So so we will be able to do that at some point, but we haven't yet, and we just didn't want to wait to get anything out until we wanted to be able to get this out and before we completed that part. We have another question from an organization who's unsure if they filled out the readiness assessment already.
So if you are unsure whether you sent it in or not, feel free to just shoot us an email at mctec.info@nyu.edu, and we will we'll look at our database and let you know.
There's a question about thoughts as to why some OASIS clinics are reporting to be more managed care ready than OMH clinics.
You know, we have talked about that internally a lot and are continuing to have those conversations both with OMH and OASIS as well as our partners and others, and would be glad to have it on a more broader scale. We're not sure. I think this is, you know, I think you could argue that one or the other is more prepared. It's just what we saw consistently in the data, and I don't have a hard and fast answer for that at this point.
When and how will the domain-specific technical assistance roll out?
So some of the domain-specific technical assistance has already rolled out. So in terms of the kickoff events and those kinds of things, we've really given some of the ballpark stuff. The contracting series we just wrapped up is all available online, both the webinars we did as well as a videotape version of one of Adam Falcone's presentations, so that's available online. So if you have questions around contracting, I would strongly recommend you take advantage of that. And then we're going to be rolling out 3 new modules in the next couple months. Revenue cycle management, utilization management, as well as starting to look at outcomes. We're also going to be doing some stuff for small providers where the details are still getting worked on a little bit, and so that should all be coming out to a theater near you very shortly. And please, you know, keep in touch with your email and those kinds of things. But we are really looking at getting those things very ramped up very quickly.
So we got a couple questions related to how this will be disseminated. Maybe if you could review the process.
Yeah, so very quickly, the individualized reports will be going out starting tomorrow, hopefully. We have to do them in batches, so if you don't get yours tomorrow, don't panic. Via email. So they'll go at least to the person who filled it out, and likely also to folks who were executives in the agencies and stuff like that who are part of our email list. They will only be going to the agency that filled it out, so your individualized report only goes to you. If you don't have any details on that, or if you don't get it by the middle of next week, please let us know, and we'll correct any errors that happen.
Have the managed care organizations expressed interest in knowing the readiness of the agencies that will be coming into their network?
They haven't explicitly. We've had several conversations with managed care plans who are interested in readiness generally, and I know that several plans signed up for this webinar today because they're interested, just like the state is, just like you are, in terms of kind of the readiness of the field. They haven't talked about the readiness of agencies specifically. Again, we will not be sharing any of this data with them other than the broad data we're sharing with you, but you're welcome to do whatever, your data is yours, and so once you get it back, you can use that as any way you want.
Okay, our next question.
Yes.
Will you be providing any guidance on provider relationships with health homes?
We are not specifically at this time focusing on health homes, but we are working in the background to develop a series that is going to address HCBS in health homes, and we're also working very, very closely with both CPI, NIAPRIS, and also the Center for Rehab and Recovery as a coalition in the city, really working on making sure that we're working closely together. And some of those organizations are also addressing health home issues. So we recognize that a lot of the changes in managed care getting hung on health are going to be really deeply integrated into health homes. And so we are going to work closely with health home providers as we move forward, and then be doing some specific training for those providers as well. Okay, next question.
What if we are not OMH or OASIS funding, but we are OCFS and
So
FED?
actually, I'm really glad you asked this question. It's a really important question. So we are also working with OCFS providers under a separate auspice, but we are using this readiness assessment. So we just did on Monday, I think it was Monday. On Monday, we just kicked off, we don't have a catchy title for it, but technical assistance for OCFS providers. And the big first push of this will be the readiness assessment. If you go on our website, or shoot us an email and we'll point you to it. That webinar is available. There's an addendum for OCFS providers to fill out in addition to this. So please go to our website or shoot us an email and we'll get back to you specifically with where you should go to deal with that. And so I'm so glad you asked that question.
Next question.
Yes.
In the past, there was discussion that there would be a webinar or information for the agency's board. Is that available?
Yes, we are actually finishing that up right now. We have somebody working on making those slides really, really pretty. All the data's in there, it's just they're not pretty yet.
Yeah.
So we have a prettifier in our office who's working on that. But we are working on 3 separate slide decks for agencies, which will be out in the next, 2 or 3 weeks. One is for agency boards and executives, one is for frontline staff, and one is for consumers. So that'll be out in there. They cover a lot of the same ground, but highlight some different things in them. So we're working on that now, and it'll be out shortly. It'll come out as a tool, and you can use it however you want. Probably we may also develop a webinar that goes with it, or a brief YouTube video or something. They'll put me in a suit and tie and make me talk on camera. Okay, next.
So one of our participants heard that an HCBS training would be done by MCTAC. Is this true?
It is true, and we are working in the background with many of the trade associations to develop a HCBS, and I would broaden that out a little bit. HCBS and small providers specific training that will focus on some of those infrastructure issues that smaller providers and HCBS providers are really going to need to focus on.
So this is a question from a foster care agency who sent in an assessment tool in December and then heard us talk about OMH and OASIS assessment responses. They'd like to know if they need to complete pages 12 through 17 on the new readiness assessment sent by OCFS. So
yes. So here's the other OCFS question. So there are about 30 OCFS agencies that also are kids agencies. There are probably more than that, but who had also completed this readiness assessment already. If you're an OCFS agency and you already completed the base readiness assessment, you do not need to complete it again. You only need to complete the addendum that goes with OCFS. So I think it's probably the pages you're referring to. All right.
This is...
we're a multi-state agency, still managed with managed care experience, but not in New York. How do you suggest we respond to the questions and answers? I would respond, in all honesty, so internally, for our purposes, I would actually probably respond nationally about your age, because it really is your global agency's ability to deal with managed care. Internally, I would probably go both ways and look at your national experience compared to the experience of folks in New York, because it'll give you a way of looking at, it'll give you a way of comparing, you know, where you are and what you need to do going forward for New York State. So I think that's a really good question, and also probably an opportunity for you really to see the differences between where you are nationally and where you are in New York.
Okay. Will there be any direct support provided? Will there be any direct support in addressing individual report needs?
I think we already touched on this one. If you look at your report, look at the recommendations. If you have further questions, please feel free to reach out to us, and we'll do our best to guide you through. Obviously, a lot of the TA we're providing is going to be specifically focused on these issues. We can't do kind of individualized consultation at this point, just outside our scope. But we'll you know, if you have specific questions, feel free to reach out to us, and we'll do our best to kind of guide you in the right direction. So the question is, for those agencies that have submitted HCBS applications already, what can we expect to hear those decisions? And will there be another application period? There will definitely be another application period for upstate. So the only ones that were required to get it in, it was in December, I believe, were the downstate ones. I don't have a timeline on that. You'll have to go back to OMH and OASS to get a timeline on that. So I would recommend you go back to them. If you want to shoot us a note, we can forward that note along. But yeah, you have to go back to them to get the formal timeline on that. So there's another question about the OCFS things. Feel free to just shoot us an email, and we'll guide you through that process. The OCFS piece may be a little complicated. I don't want to. I want to just make sure you get the specific question answered. So if you have a question about the OCFS piece and how to not do the other part, just shoot us a note and we'll walk you through it. Other questions, we're nearing the end of a really robust Q&A it overwhelmed our ability to keep track of it for a second. So if you have other questions, why don't we take a couple seconds and shoot those in. Take a second and shoot those in. And we'll try to answer any additional questions before we wrap up today. Okay, so we're just going to take 1 second and look for additional questions, and then come right back. One real basic question about specific agencies. Since we have that in the Q&A, Meg or Amanda, can you just take a note on what county that is, and we'll let you know. Actually, I would also prefer you guys shoot us a note, because that way we make sure we respond to the right person. Okay. So any additional questions that have come in that we want to make sure we get addressed before we wrap up today? Okay. One more.
So is New York State one of the first states enrolled in managed care, or what other states already started the process?
No, there are a number of states in a number of states around the country that are either in various stages of managed care or are in the process of moving into managed care. Are moving into managed care. We're doing some stuff where we're going to be bringing in folks who can talk from a broader state perspective in terms of what other states have done. I know the coalition is bringing, they have a conference coming up in the next couple weeks. I'm blanking on the date, but the coalition conference coming up in the next couple of weeks is going to specifically address this issue with trade associations from other states and also government officials from our state, talking about these issues. The NIAPRIS executive seminar is going to address these issues. The coalition conference I think is on the 20th of March. It got rescheduled because of a snowstorm. And then the NIAPRIS Executive Seminar is going to address these issues. I also strongly recommend National Council, which addresses these issues as well. So those are a lot of stuff's on their website. So those are some other resources you may want to look at for other states' experience. We'll be doing some of that stuff as well, but I don't want to just tie people to what we're doing. I really would look broadly to the experiences of other states.
One more question about HCBS services. One of the participants tried,
yeah, so we will, so on the HCBS stuff, I really would recommend if you haven't heard back from OMH, to let us know, and we're glad to forward that along. I would also recommend going to your field office too, because I think the field office may be a better bet sometimes for getting specific questions answered. It looks like we've gotten some more Q&A down at the bottom because that number's gone on. Yeah. All right.
Will all of the questions asked today be added to the current Q&A document?
So all the questions asked today will be available to folks, and we have kind of two versions of Q&A. There's the policy Q&A, and then there's Q&A that's just about these kinds of things. These kinds of things will be available on this webinar. The policy Q&A stuff is available on kind of our formal Q&A because that gets vetted by both OMH and OASS to make sure it is official when it goes out.
So one participant was wondering if we could just briefly go through those three presentations, the slide decks that we talked about, and the audience.
Oh, very good. Yeah, so we have 3 slide decks coming out in the next couple of weeks. One is geared towards senior executives and boards, one is geared towards frontline staff, and one is geared towards consumers. And those are going to be coming out in the next couple of weeks, and they'll be nice and pretty, and you can download them and use them however you want in your agency. And again, they may, put me on camera and make me do a little video to go with that.
And someone else asked about, in terms of HCBS training, our timing.
Yeah, we're working on the HCBS training. Our biggest issue, and for those of you who live in the New York City area, you'll understand this really acutely, is space at this point. So we have to find a space that we can accommodate a lot of people in, both upstate and downstate. So we're hoping to do it in the next month or so, but it might get pushed out a couple of months just until we can find a space that's big enough to hold everybody. All right, I think, we got one more. For providers and family youth support, since this is a service that will now be reimbursed by Medicaid, but any way to capture the needs of the providers in a specialized report. We are looking at ways to do specialized services around HCBS services. We may develop kind of a mini addendum on that a while back, which is not available publicly. We may do a full addendum on that going forward, but we're just not sure yet. But we are going to be providing that kind of specific service going forward. So I think that is the end of the questions that we have received. So I want to take this opportunity to really thank everybody. Thank everybody for joining today. Again, if you completed the Readiness Assessment, you should be getting your report in the next couple of days. If you didn't complete the Readiness Assessment, we strongly recommend that you take advantage of that. You take advantage of that now. The webinar and the slides will all be available online in the next couple of days. We really are really excited that so many folks were able to join today and participate in this. If you have additional questions, you can also always reach us at mictac.info@nyu.edu. Big announcements go out on our Twitter feed at CTAC-NY, and also we can be reached at the managed care at mictac.org, which is our website. And that website, we have all our announcements. This webinar will go on the website. Tools, resources, all that stuff is up there. So I want to take a minute to just thank everybody for joining today, and hope folks continue to do well in this lovely weather we're having here. I'm looking out the window at an ice floe passing by on the Hudson River, so it's just lovely weather today. But I want to thank everybody for taking the time out today to join, and we look forward to seeing you at our events going forward. So thank you so much.